Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hanna
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin. Welcome to a next episode. We're talking about wisdom teeth.
And today, I think we'd like to answer a question which we sometimes hear, and that is, can a tooth still hurt after an extraction? Meaning, I have had extraction, my tooth has been removed, but I do still have a pain. Is that possible?
Well, you don't often hear this because it's usually a hidden chronic inflammation which is developed after the teeth are removed. But occasionally you can hear that. And that's because our body was not ready to heal because we did not have the building stones to recover the wound, or the socket didn't heal in a primary way.
So I would just say simply, yes, it is possible that you do have a pain after a tooth extraction. It's not like, we don't mean it like 2 weeks after in terms of the right after healing period, but you can have pain even after a month, years later. And when we take an X-ray, and to be specific, when we take a 3D scan, which means a three-dimensional scan, not all the dentists do have it. We are grateful that we do, and we believe all the biological dentists in our community do have to have it, because if you do ceramic implants, you need to know where you're going. So 3D scan is a must. If you've never had a 3D scan, please do have one.
If you have any issues, and that's, we started with the question, does the tooth hurt? But I think we should go beyond the tooth hurt, because there is more symptoms, more signs of the body which are hurting in a way, which is digestion, which is the heart issues, arrhythmia, palpitations,
hyperpressure,
which is the elbow or the shoulder frozen, or elbow tennis elbow. So there is more behind it, which is connected with the fact that the post-extraction area did not heal well.
So why is it that it doesn't heal well? I was questioning myself. So there's a couple of reasons why, or main reasons why the area after extraction doesn't heal well. One be that the extraction hasn't been done in a great manner, meaning the tooth hasn't been extracted fully. There have been parts of the tooth left behind, and that is irritating the body, and the body can't heal the bone properly. The other reason...
Even the tissues, which is not the root of the teeth, but mainly the tissues, the ligaments and soft tissues, which are part of the body.
And the other reason, which probably is more common, is that most of us lacking vitamin and minerals in order to heal the area. So that is the reason why at DuoSmile we do recommend to get ready for extractions. We recommend a month before and a month after to honor and follow certain protocol. The protocol consists of 2 parts. One is nutritional, second one is supplementations, and people are ready, for their bone healing, so-called. Mm-hmm. The reason why the bone hasn't healed is that the body, like I just said, most of the times is lacking building blocks to heal the bone properly. Mm-hmm. And what can happen is that the body develops cavern spaces in the area of the healing, which can be filled with toxins, which can be filled by parasites,
well, if you
bacteria.
Take tests from the tissue you remove later on, you will find a panel of bacteria, viruses, parasites, and candida. So it's amount of toxins your body has to deal with. So that's why in certain places you're hold on and you're not thriving. So for me, it was energetic level. I didn't know that I could have more energy. For some people, it's chronic fatigue. For some people, it's arrhythmia. For some people, it's
high blood pressure.
SIBO. For some people, it's frozen elbow. So it's a connection. It's connected with traditional Chinese medicine. And I love to combine the ancient wisdom with the modern tools we have, which is how we support the body, how we diagnose things. We have 3D image, and then we could use centrifuge, and we could boost the blood and then separate the plasma and use it full of nutrients and growth factors and goodies for the body to recover. So we would like the bone to heal in a primer way, which is, you can imagine if you break your leg, and we're not talking about only now extraction, wisdom teeth, but we're talking about situations in life. So if I hurt myself, if I fall down and break my arm, I would like to do the same protocol. I would like to heal fast and have support nutrients into body. And I feel that our system is not smart enough. Our doctors are not recommending us to do that, to use more supplements, more proteins in order for the body to heal itself. So we are supporting our bodies only with the technology we have these modern days. So we're going back to basis, and we would like the body to heal it on its own. And the primary way is that the bone structure, the bone cells, they nicely develop in the area, in the socket where the root was, and beautifully seal every little part of it. If not, we would develop cavitations, which are the caverns full of chronic inflammation. And that's part of our story and part of our colleagues' story as well, because it's not something which they are teaching us at university, not even on a dental university, not even on a medical university, because we have studied both. They don't really believe in this situation. So I hope,
or better said, they're not aware of it.
We would at least give some information to our clients who come to us, or for you who are listening, and you would be able to dig deep into this if it attracts you and if it does make sense for you.
So what we do recommend to clients, because of course we do have different groups of clients. Some clients come over to us and they're very, educated already. They read stuff, they've seen stuff, they do have issues, and they do have the information. So, and they know that the body is interconnected, and it's not about teeth. There's a whole body dentistry, what I call. Everything is connected to everything. But then there are other clients who might not be aware of it. And to those clients, we need to, explain what we're thinking, what, the connections are, that the tooth is not just the tooth, that the tooth's got a connection with other parts of our body. In terms of wisdom teeth, like Eva said, it's a lot about energy levels and emotions. The main organs are heart and small intestine. But then there's involved central nervous system, peripheral nervous system. That's why many clients of ours come over and complain about depressions, anxiety, lack of joy, or sadness. It doesn't necessarily need to be depression. There are 50 shades of this emotion. So, some people really, I've had a lady who said, I don't have the lust for the living. I don't have that, I feel like I've got everything, but I don't have that joy, the spark. So a lot of people name it in different names, but actually it all like lands on our, knowing and wisdom of the traditional Chinese medicine, because we know that these kind of emotions of loneliness and not being loved enough, that's all wisdom teeth. Some of you might be laughing because what's the teeth to do with the emotions like this? But they do have a lot with it. And
we love to see the transformational stories of our clients, how they get back to them, how even some of them on the dental chair, they are changing their mimics. They are grateful They are tears of gratefulness and they're softer. So
that actually happened to me as well, Eva, right? Remember? So when I've had my cavitations, and maybe this is important just to say that I have not had my wisdom teeth. We haven't actually talked about this situation because you can have problems even now you do not have wisdom teeth. So Eva and me, we didn't have evolved the wisdom teeth. And probably that was the reason why we have never even thought about having an issue in that area and had a possibility of having cavitations. But anyway, we've shared our story before. I'm just gonna cut it through right to my experience. So Eva was talking about emotions and gratefulness. So for me, it was almost like a spiritual retreat. I've had my heart open. I started to cry after the procedure. Not that I was in the pain, but I was just really, the heart opened. I felt lighter. I felt grateful for everyone and everything. I've experienced so much love burst into my body. And yeah, I wanted to share it with everyone.
it was like you would lift the lid from the pot.
I did look differently, right? You and Dominic was seeing it as well. What happened on a physical level, I used to have diarrhea in the morning, and then I no longer have a diarrhea in the morning. Again, that's another signal or testament of like a heart and small intestine connection.
Lots of people, they know about SIBO. So this is,
SIBO. So-called SIBO, or gut issues, chronic inflammation of your gut and gut digestion problems, really. What happened to Dominic, actually, Dr. Dominic Nischwitz, who's an author of a book called It's All in Your Mouth. He is probably, for me, he's a leader in a biological dentistry. He's like just formed a community of biological dentists where we co-elevate. We've just been so many times in Germany, and we, for our education and also for our cavitation early on. And so what he's sharing in his book and what his story is about the cavitation is that when he was 18 or 20, he needed to have his wisdom teeth removed. His dad is a dentist. He still works. So we know him. He saw him in the clinic.
He's an amazing guy. So
he's an amazing guy. And he suggested, and he suggested that he needs a wisdom teeth removed because they were impacted. They didn't have enough space in his mouth, and there was a chronic infection. And Dominic was and is like a great example of how not to do it. And he knows from his experience that this is not the way to do it, be it having the wisdom teeth removed without any support and any preparation. What he basically did when he was like partying and drinking alcohol.
And he did lots of sports. So it's another stress to your body, which means that you need more nutrients.
And what he found very, very, like sometime after, like many years after this, is that he's developed skin conditions, and he was feeling like he was thinking, oh, am I becoming a bipolar at one stage? Because his moods were changing like the April weather, we call, up and down.
He had depression.
He had depressions, like mood swings, like a bipolar. So like hyper and then very low. And so he thought, oh my goodness, what it is? And he was lucky enough, and that's part of his like journey. I think there are no coincidences, so that was meant to be. He met a professor, Johann Lechner, who is a German doctor, dentist, who is for decades, studying and researching the connections of this chronic inflammation in a bone, so-called, sometimes you can hear it as an NICO, N-I-C-O, or cavitations. We like to call it cavitations. Some people call it FDJ, fatty degenerative jawbone osteonecrosis. And so he is not even that he was just researching it and finding the connections. He has written about 4 books, and he is explaining and he's providing data, what the connection is about, and, how certain inflammatory markers are visible. And so, saying how not healthy the tissue and the not properly healed jawbones are. So for anyone who wants to, again, read more, dig deeper, Johann Lechner, some of the books are in German, but a couple of books are in English. We did share it on our Instagram, so you might be able to find it.
Yes.
But
and
what I just wanted to add before you ever jump in is that he found a connection between autoimmune disease and cavitations, tumors and cavitations, chronic disease, you can name it, chronic fatigue, and, anything you can actually think of, cavitations may have been behind. And for me, it's kind of common sense because it is a chronic infection which is holding you back. And especially if it's in the area of wisdom teeth where the emotions, again, traditional Chinese medicine are, or the central nervous system is, that is saying. And just to complete Dominic's story, so after he has had his wisdom teeth removed, the cavitations cleaned in a proper manner, meaning, again, infusions, plasma, ozone therapy, the way we do it, the symptoms disappeared. He no longer had skin condition. He no longer had mood swings, and he kind of felt like he's got a new, energy boost. And, he felt well for exercising and doing his skateboarding.
And I love his story because he's also sharing how he was experimenting on himself. Because if you're looking for an answer, you try things. So with Dr. Lechner, he does neurotherapy, which is that you would apply a little bit of local anesthetic to the side of your cavitations or root canal treated tooth or where the chronic inflammation is. And Dr. Dome, he is bodybuilding. He
Bodybuilder.
has beautiful exercises, body lifting, and he always thought, I have overdone my shoulder. And he was trying to put a little bit of local anesthetic to part of the neurotherapy procedure towards his arm. And that's how he found out that it's connected, because he had big relief. So sometimes with clients who come to us, and for lots of them, we're very grateful for our clients. So they all come for a reason, and they're ready for things. But the ones who have never heard of these things, we could apply a little bit of these local anesthetic towards the cavitation area or root canal treated area. And then in spot, they see relief if they have a block in their back or in their arm, shoulder. They're like kind of moving around. Oh, it's disappeared. So there is a direct link towards it. And for me, when we did the test with Dr. Dome, before we did our cavitations, it brought me to gratefulness within seconds. My knees bended and I was very grateful for things, and which is, again, very difficult to explain the emotions, because we think, it's a body, it's, part of, it's connected part of the bodies, but the emotional part, it's so smart. I don't think we will ever see through every little detail how it's so smart, the body, and how it can heal and what is the message behind things. So very little test which could tell you, and we always say to clients, monitor yourself 24 hours. And write down what was happening. You can have a big chat with your wife, or you can have lots of energy, or you can have lots of anger. Just point it out.
Yeah. Or even little things like reactions, different reactions, responses to certain stuff. Yeah. So I know on myself, or some clients share, I responded in a different way to something which annoyed me and I couldn't.
Yeah,
and
that's the anger.
So yeah, it could be, or in a nice manner. It doesn't necessarily need it to be in an anger way, but it is, like you said, very important to write down on a paper, because sometimes these little things you don't realize, and you see it after a few days when you read it. So it is important. Yeah. Okay. So that was great.
So yes, I repeat the question, can a tooth still hurt long after extraction? So we connected with the full body, whole body. We were connecting the lungs with heart, small intestine, but also emotions, energetic level, and neural system. And we added stories from Dr. Dominic Nischwitz and from our stories, because we all three were connected with the fact that we had cavitations.
Yes.
Okay, take care.
Yeah, so I hope
and-
it will help lots of people to find out maybe what's behind their issues. Thank you for listening and see you in a next episode.
Thank you for joining us on Healing Through Dentistry podcast. We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care.
And we will see you in the next episode.